Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
If someone said to you, you can get smarter, what do you think that means? Well, it's not really. What we're really going to be talking about would be people who have dyslexia, because that's a big problem in their life. And we were very happy that we could get a physician who really understands this. He's a renowned psychiatrist and neurologist who deals in this. It's Dr. Harold Levinson. So thank you for coming on the show, Dr. Levinson.
Oh, thank you for allowing me to appear.
So tell me something. Why did you decide to focus in as a psychiatrist and neurologist? Why was dyslexia so important to you?
Okay. When I first started my research almost 50 years ago, dyslexia was thought to be a severe reading disorder due to brain damage. It was thought the reading processor within the thinking brain was impaired, and so clear signals that came in from a book or whatever were just not comprehended. And for almost 100 years, researchers have been following this lead, and it led them nowhere. They've gotten absolutely nowhere with understanding what dyslexia is or anything like it. And the reason I titled my book Feeling Smarter and Smarter is, although dyslexia has been commonly related to a reading disorder, the most important and severest symptom, believe it or not, is what it does to the self-esteem of individuals. The brighter kids are and adults with this problem, the more devastated they become emotionally and the dumber they feel. And not only have I come up with a very simple understanding of what dyslexia really is, and I've come up with a treatment that can rapidly reverse the symptoms, sometimes within a half hour to an hour. Of course, sometimes within a week or two or more.
Amazing.
Depending on the dose and whatever.
So, but someone first has to be diagnosed with dyslexia. And how is that done?
Yes. I've written the book, as I said, Feeling Smarter and Smarter. And in the book, I have not only a self-diagnostic evaluation where people could read about the symptoms and identify themselves, but there are medical ways of diagnosing this disorder that's 100% reliable. So let me explain what dyslexia is. It was thought to be a reading disorder, one main symptom. In fact, it isn't. It's a syndrome of many and diverse symptoms, just like the flu. Temperature is not the only symptom of a flu. You can cough, you can throw up, you can have diarrhea, you can have a million different symptoms, all of which revolve around one common origin, the flu. Well, what I discovered after examining thousands and thousands of bright and gifted individuals who've had reading problems is they not only have reading problems, if you clarify what they are affected by, they have writing problems and spelling problems. Their math is difficult. Their memory may be poor. They may have speech problems like stuttering and stammering. They may have poor directional sense and time sense. Their concentration may be off and often are distracted. They may have a whole slew of psychosomatic headaches, dizziness, motion sickness symptoms. And very often when they develop, they're late crawlers, late talkers, and on and on. And what I discovered from all this is they don't have brain damage as everybody else had thought. They have a simple inner ear problem and a disturbance within the supercomputer of the inner ear called the cerebellum.
Wow.
In other words, I can render every listener of your audience temporarily dyslexic. All I have to do is spin them around long enough till their signals are dizzy. And they won't be able to read straight, write straight, talk straight, concentrate, walk straight. They'll have phobias. They'll be afraid of heights and elevators because their whole visual perception is disturbed and their whole sense of motion processing is off. And if you allow them to recover, all these symptoms disappear. So it can't be brain damage, obviously, and it has to be something reversible. And it has to be something within the inner ear, otherwise spinning couldn't cause it. And in fact, the astronauts develop dyslexia or reading upside down and backwards when they're in space. at zero gravity. So triggers, barometric pressure, zero gravity, and on and on and on, ear infections, anything that disrupts the inner ear function can cause signal scrambling. And when there's signal scrambling, it means that you can have a normal and superior thinking brain. But if your reading center gets scrambled signals, you won't be able to read straight. If the writing center gets scrambled signals, you won't be able to write straight. Spelling, math, speech, any of these major processes within the thinking brain can be secondarily impaired by receiving scrambled signals from a disturbance within the fine tuner of the inner ear, and as I said, the supercomputer, the cerebellum. The biggest and most important thing is, as a validation and a treatment, if you successfully diagnose this disorder and treat it with inner ear enhancing medications and nutrients, that's like stopping somebody from spinning. Suddenly, if you were spinning before, you're given medications and nutrients, and you stop spinning, and your signals stop spinning. Suddenly, you're normal. Your balance isn't off. Your reading is all right. Your writing is all right. Your spelling and memory and concentration is suddenly normal-like. The same can happen with severely impaired, not only children with this disorder, but adults. Every child with this disorder becomes an adult with this disorder, contrary to what people think. The symptoms may change over time, and in fact, may become much more complicated because children are sort of more protected in a school environment, whereas an adult has to strike out, get a job, take care of a family, and make major decisions that he's physiologically incapable of handling often effectively. Now, obviously, many dyslexics do well, but unfortunately many don't, and many are in dire need of successful understanding and treatment. And the better you understand this disorder, the better you explain it to children and adults with this disorder, again, the smarter they feel, because insight is very important. Otherwise, they feel brainless. They think there's something major wrong with them, and you can't con them out of it. You can't compliment them out of it because they know there's something wrong. But if you can't explain every single symptom and why it happens, and you can't improve their symptoms, they're not going to believe you. And this book does all of it.
Well, I'm so interested in what you're saying. You're so articulate and you're so smart about this. Smarter, right? And I'm just curious, though. There are organizations, there are places that people send their dyslexic children. So is it they haven't read what you wrote, or why is this a secret?
It's not a secret. It's a different belief system. They have a belief that's almost 100 years old or more that is due to a thinking brain damage impairment. And they feel that they don't understand the origin, they don't understand the symptoms, they don't understand the mechanisms, and they're preaching to a 100-year-old choir with no effective medical treatment. They're still doing the same therapies that were proven helpful years ago. It's not that these therapies aren't helpful, they are, but they're minimally helpful. In other words, any therapy depends on signal input. If you teach somebody, they're viewing signals you're telling them and signals they're seeing. No matter what you do, if you do sensory motor therapy, they're depending on motor signals and visual signals and sensory signals. If the signals are impaired, it's an inefficient treatment. If you first medically treat them and the signals are improved and the symptoms are improved, all the other therapies that are helpful are much more efficiently performed.
Now, what kind of medicine are you talking about? You said something, you put something in the ear. It's nothing.
No.
Okay.
No. It's inner ear improving medications. They can be as simple as Dramamine or Bonine or things that improve the inner ear.
Oh.
For example, if your audience is now spinning around, I've spun them all around.
Yes.
The reading, the water, the words are jumping up and down the page.
Yes.
The world is turning around. They're off balance. And I give them these medications. They more rapidly improve. If I give them the medications before the symptoms arise, before I start spinning, I can actually prevent the symptoms from arising. So that if I can treat individuals screened for this disorder before symptoms arise, before academic symptoms arise, I can prevent many of the symptoms from ever occurring, or at least minimize their intensity before it starts.
Okay, but now you have such incredible credentials. You've been around for quite a while, and so this wasn't always your strong interest, was it? Is this something that's popped up?
Yes, I was trained as a psychoanalyst, and I was hired by the New York City Board of Education because they thought it was a psychological problem. And many people wrote books about the psychological origins of dyslexia and reading disorders. They even ascribed wacky Freudian ideas. Not that Freud was wacky, Freud was brilliant, but these so-called super Freudians who tried to out-Freud Freud developed their theories on their own. And you know what happens when people try to best an Einstein. They fall flat on their face. So they came up with stupid theories that made no sense. It was obvious from what they said that they didn't examine these children. They just theorized about them. They wrote well. They had reputations. And people not understanding it bought it. But it made no sense to me. So then I went to the neurological theory. And I was trained neurologically as well, and I enhanced my training. And the neurological theory at the time was based on a simple concept. It was known that adults who have a trauma to their brain can completely lose the ability to comprehend the reading that they did before. In other words, they're looking at English and it looks German or Russian. Makes no sense to them. That's because they have a processing impairment and their disorder never improves. Then we came across, in about 1896 or so, children who were bright and started and developed difficulty with reading. They didn't have a reading comprehension problem. They had reading reversals. They would lose their place when they read. The words got blurry and doubled up and wiggle on the page. They had a reading disorder, but they also had writing problems and writing reversals and spelling reversals and math reversals that the alexic adults didn't have. So we were dealing with two completely different disorders that had a reading symptom in common, and the reading symptom was completely different. But nobody would admit that. They identified the two disorders as if it were identical, and they went at it for over 100 years trying to prove a nonsensical concept.
So
and they got what they deserved.
Are you going to get the Nobel Prize for this? I would hope you would. This is pretty serious.
Well, I'd like you to be the first to recommend it. Okay.
Well, I'm going to work on. I'm so happy that that you sent me the book. I'd like to talk more about that to make you more really feature your book and all. This was like a little teaser to have you on for 15 minutes, but you're terrific. I mean, once I got your bio, your resume, I have to tell you, you're absolutely astonishing, and I'm so happy that you took the time to do this, and we'll be talking to you again. I'm going to call you because I'm so impressed with what you've done.
Can I leave you with something interesting,
Please.
like a dessert?
Okay, give me dessert.
I now, having examined and successfully treated these dyslexic children and adults, I stumble on the fact that with the same treatment, many of their phobias disappeared.
Of course.
They no longer were afraid of heights and elevators and escalators
Fantastic.
and traveling.
Of course.
I suddenly realized that it's because there was an inner ear problem. If you have an inner ear problem and your balance is off, you're going to be afraid of falling.
Yeah,
and if your
that's right.
motion processing is off because of the inner ear,
Yep.
you're going to be fearful of certain motion triggers,
Right.
like moving elevators and escalators. So I was able to treat and understand
Yep.
a whole slew of phobias that were psychologically believed to be the cause of this problem.
Thank you, Dr. Phobia. And we are going to have to go, but I'll be back in touch. You're terrific. Thanks for taking the time.
You're welcome. Bye-bye.
Bye.